So I'd say my decision to pursue a career in healthcare started back in junior high school. I found myself in the Ghana Red Cross Society. I honestly don't even know how I ended up there, but I enjoyed the work. I enjoyed helping people. I enjoyed being the one to be called, particularly when there was an emergency situation. And I always wanted to find out what happens beyond the first aid we give.
My motivation to be a nurse came from a personal experience. My little brother was diagnosed with a hole in heart 10 years ago and was admitted for surgery. Anytime I visited the hospital, I liked the way the nurses and doctors went about their work with confidence and professionalism. And it made me gain interest in the act of healing and also being there for people in times of desperate need.
The healthcare is a very interesting field of study, and I chose it because it gives a certain form of satisfaction to see a patient that was unwell when they walked in your facility and you help them through until the time they get better.
It's a career that I've always wanted to pursue in. Why? Because I've always wanted to help others, to help the community, to help people who are sick in hospitals, at home. So I saw it fit that when I do nursing, I'll be able to give them my efforts and the abilities that I have provided to them.
I honestly wouldn't say I pursued a career in nursing. Becoming a nurse was more of an expectation of me growing up. Even when people ask me, what do you want to be in the future? I had this rehearsed response in my head that I give them. But now when I find myself in nursing, I know it is a whole lot more than I expected. It is a wonderful experience and I wouldn't have it any other way.
So one of the most popular health policies currently is universal healthcare. And at the bedrock of this is primary healthcare, which I believe is basically decentralizing healthcare and bringing it to the doorstep of every Ghanaian. And I believe this is what Muti Doctor is about.
I feel it is a very good initiative, and especially that we're living in a time of the COVID pandemic, where they talk about social distancing, not being in a crowded place. So Muti Doctor is a platform that gives a patient a chance to be in a facility that is, one, not crowded, two, it's going to cut off the cost implication on the patient.
So currently we are able to conduct quite a number of rapid diagnostic tests, including typhoid, malaria, H. pylori test, which commonly causes peptic ulcer. We can look into the mouth, into the ears. We can examine the chest, the heart, and look on the skin to see if there's anything going on wrong there.
Our patient complained of having pain in the left ear, as it were. And so I asked her to say, what interventions have you received from the time you had this pain? She went ahead and told us to say, look, in 2020 I had a similar condition and I went to the nearest clinic where they only gave me paracetamol. And so I don't see why I should go back there. So I asked her to say, can we check your ears? And she was agreeable. And using our Title Care, we were able to examine the ear, and we found a plug of wax in her left ear, which was giving her the symptoms of the pain and, of course, the hard of hearing. So upon the completion of our examination, we ordered her to get some ear wax softener. And fortunately, she was able to buy the medicine, and she instilled the drops in her ears as we prescribed. And on the third day, she returned to our pharmacy with a very great improvement. Her hearing was restored. We checked the ears again. The wax impaction, which was in the ear, had resolved. And I was satisfied as an attending clinician. And the patient was overwhelmingly happy with our service.
The response from the community nurses has been good so far. The people are appreciative of how they get discounts on their medications and how affordable the medications are. And some of them have been diagnosed with conditions they didn't know they had, and they've been referred to seek treatment from the Muti Doctor.
The community response to the service so far has been really, really positive. They welcomed us with their open arms, and since we started, it has been one testimony to the other. Like they said, Muti Doctor is free, it is fast, it is easy, it takes off the stress of seeing a doctor physically away from them. So it has been a wonderful experience so far.